Recently, Scott and White announced its game plan for 2019, and it includes some pretty big changes to what we have been doing with them in the past. In fact, breaking news, if you haven't heard it, Scott and White Health Plans is non-renewing all Vital Traditions HMO members in the DFW area for 2019. In addition, Scott and White Health Plans is non-renewing all Medicare cost plan members in Central Texas for 2019. Now, we already kind of knew that. We knew that that cost plan in Central Texas was being sunset by the government, but this is it. This is it. They're done. Between Vital Traditions in the Dallas-Fort Worth area and the cost plan in Central Texas, Scott and White is estimating that nearly 35,000 Medicare members will be looking for a new plan and will be receiving non-renewal notices as soon as next month. So a couple things. As you guys know, for quite a few years, we were one of the leading producers of the Scott and White Vital Traditions product, the HMO here in the Dallas-Fort Worth area. We got thousands of members, and a lot of the agents that have been selling that product are on this webinar. So the first thing you're going to have to do is put together a game plan on how you're going to address all these members that are about to lose coverage. And we'll go through some details here in just a moment about that. Then, in addition to that, you got all of those cost members. For those of you who might have worked in that call center, you guys also sold a lot of cost plan members, and those people as well are being non-renewed. Now, not all is lost. We do have some alternatives that Scott and White is launching that can help you to try to retain some of that membership. But if I were a betting man, after seeing these, you're going to say, better make sure we got United and Humana to help move some of these members. 35,000 of them, guys. That's a lot of members in play, and we got to make sure that we are not only taking care of our clients and getting them the right plan, but also making sure we're protecting our renewal commission. Now, here's the good news. Scott and White is introducing brand new for 2019, 3 new plans. They're introducing an HMO in Central Texas, a PPO in Central Texas, and a PPO for North Texas. All of them are called Senior Care Advantage. So what I thought I'd do is take a few minutes, and in case you haven't seen it, and I would imagine most of you have not, we're going to go through each one of these products and talk about strengths and weaknesses and what we should be doing with these things. So let's first focus on the Senior Care Advantage HMO product for Central Texas. I think this is going to be the primary workhorse. I think you're going to see that this is really what Scott and White intends to use in order to replace all of that membership in Central Texas. I think the breakdown is something to the effect of 28,000 members in Central Texas, something like 7,000 members, I'm rounding, of course, in North Texas. So it's the Central Texas that has the biggest membership base. They got 3 versions of the Senior Care Advantage HMO product. There's a 0 premium version, but I think you're going to see they're also going to be really heavily promoting the higher level ones with a premium. The preferred and premium level includes Medicare prescription drug coverage for $130 or $240 a month, so not the cheapest thing in the world. Now keep in mind, the people in Central Texas were not 0 premium people. They were paying for that cost plan. It wasn't a freebie. None of them have any deductibles. They all have nice out-of-pocket maximums, $0 copays for primary care physician visits, specialists, diagnostic testing. I won't read this whole thing to you. Hopefully you can see this. A couple things that I wanted to point out, though. They've got a $50 or $40 copay on urgent care. They've got on their premium plan a 0 pay copay for outpatient surgery, a 0 pay copay for inpatient hospital. So if they're looking for a a copay buy down, that's what they're going to get with that premium product. Okay, but it's going to cost them $240 a month. So that's the Central Texas HMO. Let's talk a little bit about prescription drugs and how they're covered with Scott and White's Senior Care Advantage product. As you can see, there is a deductible that applies to all three of the plans. As you'll also notice, there are pretty low copays for your tier 1s, and then some of them start to get a little higher when you get to the tier 2s and the tier 3s. And of course, there's going to be some discounting through the coverage gap, and then you get to the catastrophic. Keep in mind that all of these plans can be with or without Part D. They do not have to include prescription drugs on the HMOs. Now, I don't know what you think about these plans. A couple things you should know. First of all, one of the reasons people bought those cost plans is because it allowed them to go out of network, and of course an HMO does not. That's going to be an adjustment. They are going to have a zero premium to offer some of these members, so that's the nice thing, but it's going to be tough trying to get people to cough up $240 for that premium level, even with the copay buy down. So the other product that's going to be offered is the Senior Care Advantage PPO in Central Texas. As you can see, it does have a premium. And it's got some nice benefits, including a zero copay doctor office visit, including nice benefits for inpatient hospital and outpatient surgical and urgent care. Nice little benefit. That basic plan, as you can see, the $43 premium, I think that's sellable in Central Texas. I don't think you're going to see a whole lot that looks better than that. And then the higher level product has a $150 premium. That's a bit stout. The nice thing about this, though, is that even at $150, a lot of these cost members were paying, you know, $70, $80, $90, $100. So going to $150, keeping your PPO, having a reasonable MOOP, I think that might be a product that that a lot of these members might buy. The Part D, or I'm sorry, the drug plan that is included in there, again, on that higher level PPO has no deductible, whereas the lower level one does have a $250 deductible. Pretty reasonable copays on the drugs, and again, discounts to the coverage gap. We have all this, by the way. If you send a note to sales, I'll be happy to get you a copy of the whole plan grid. New for North Texas is a brand new, oops, that says HMO. That is not an HMO. It's PPO. Sorry about that. Anyway, new for North Texas, they are getting rid of the Vital Traditions HMO and replacing it with the Senior Care Advantage PPO. Senior Care Advantage PPO has a $41 premium, kind of high, considering you can get United for, you know, $20. You can get Humana for around $20, and both Blue Cross and Cigna are introducing zero premium PPOs in the Dallas-Fort Worth area, so that might be a tough one. The nice thing about it, though, is you do probably have some members that just say, nope, I want Scott and White, I want my Baylor, and I don't want anything else. This might be the solution for them. They're going to have to cough up $41, so hopefully they really want it bad. The inpatient hospital copay is $350, is kind of high. The outpatient surgery copay is $350, again, a little high. It's an okay product. I think if I were sitting in front of a client who has Vital Traditions HMO, and you're certainly going to want to say, hey, this plan's being non-renewed, and there is a PPO that you can buy instead, but there are lots of great plans out there. Let's talk about what your needs are, who your provider is, what plans they participate in, and so forth. Again, I apologize, it says HMO, but this is a PPO. But anyway, here's the PPO and their drug benefits. It does have a $300 deductible, but it only applies to tiers 3, 4, and 5. That's pretty decent. Pretty decent copays. Like I said, this is, if I had to say it, it's sort of a middle-of-the-road PPO plan in the Dallas-Fort Worth area. But there are some nice extras that come with these plans. So what you should see from this, if you look in the top of this grid, you'll see kind of a greenish blue, and you'll see sort of a pink, and then you'll see a blue at the bottom. So that reflects the Senior Care Advantage HMO for Central Texas, the PPO for Central Texas, and then the PPO for North Texas. As you can see, that HMO has a whole bunch of nice freebies, including a zero copay for routine eye exams, includes benefits for eyewear. It includes a hearing exam. It includes a hearing aid. It includes a fitness, a Silver and Fit membership, and it includes dental, which is nice. As you know, that MetLife dental network is a nice big network, $1,500 per year benefit. If you look in that middle section where you see it in pink, that's the PPO. Again, you got routine eyes, you got eyewear, you got a hearing exam, you got hearing aids, you got fitness, and you get $2,000 in dental if you add the $20 buy-up. And then with the PPO in North Texas, again, eye exam, eyewear, hearing exam, hearing aids, Silver and Fit, but no dental. Okay. Well, that's a lot of information. As far as the dental benefits goes, you know, you guys probably remember we spent a lot of time on this dental plan. We sold a lot of Scott and White based on this dental plan, but it's still pretty strong. The HMO in Central Texas includes the dental benefit, so there's no additional premium. You get $1,500, no deductible, zero copay on exams and cleanings twice a year. Your x-rays are zero, extractions and fillings and dentures are all 50%. Similar with the PPO plan, just have a $2,000 yearly max and a $20 premium. And then as you can see in the Central Texas PPO plan, included in the platinum level, $20 premium in the basic. And keep in mind, this is the MetLife dental network, which is a pretty nice network. But I can see everybody on this call remembers back a few years ago when we used to talk about this so much. All right, so that is what Scott and White is doing for 2019. So just a real quick summary or review of what we talked about. Vital Traditions HMO, Medicare cost plan, both being non-renewed for 2019. 35,000 members are going to get letters saying your plan is non-renewed. New plans being introduced. Central Texas, there's an HMO and a PPO. North Texas, a PPO only. If you're selling your Central Texas members on a new plan, certainly can take a look at that HMO and the PPO and see if that fits. It seems like compared to what else is out there, it's got some nice bells and whistles at a reasonable price. However, do keep in mind United Healthcare is rolling into Central Texas this fall as well, so keep that one in mind. Same thing here in the Dallas-Fort Worth area. Take a look at the PPO. It's okay. There's probably some better ones out there that you might like from United, Humana. If the network isn't the issue, then Cigna and Blue Cross are going to have zero premium plans. But long story short, better get your list together of your Scott and White members and have a game plan on how you're going to engage them. And one of the ways that we're going to help you is I'm so pleased to introduce our brand new, we just launched it today, NALP Medicare Marketing Allowance Program. It's brand new for this year, and we're really excited about it and hope you are as well. What is it? So the Medicare Marketing Allowance can be used for any marketing expense for any carrier. All Medicare Advantage and Part D sales count. Medicare Advantage is counted as $1,500 in annualized premium, and Part D is counted on as $200, which is both are sort of industry standard how FMOs and carriers count what Medicare Advantage and Part D counts in terms of annualized premium. We have multiple marketing allowance levels available depending on your sales, on your production. Marketing allowance expenses are reimbursed so that it is not taxable income to you, and to make sure that we are CMS compliant. I can't just write you a check. Commissions are regulated. And we'll, on top of it, help you get everything set up and work the way you want. So, how does it work? The Medicare Marketing Allowance is based upon paid annualized premium. Starts at $30,000. And again, remember, Medicare Advantage counts as $1,500, PDP counts as $200. So, starting with $30,000 in paid annualized premium, we'll provide you a $2,500 marketing allowance. Starting at $45,000 in paid annualized premium, we'll provide you a $5,000 marketing allowance. get this, with $90,000 in paid annualized premium, we will provide you with a $7,500 marketing allowance. I don't know of any marketing organization anywhere that is providing its agents with $7,500 in marketing allowance dollars to help cover their marketing expenses. This program is available for all contracted and certified agents, and the time frame is the selling season starting October the 1st and running all the way through March 31st. All Medicare Advantage carriers and products are included, and all Part D plans are included. So how might this work for you? So here's a couple of examples, or 3 examples. First one is somebody who has, a good selling season. Maybe they sell 25 MAPDs and 10 PDPs. As a reminder, MA counts as 1,500, PDP counts as 200. And then when you added up, this particular good producer, good selling season, had $39,500 in credit or annualized premium, and they got a $2,500 marketing allowance. Somebody who had a better season, had 50 MAPD enrollments. They didn't have any PDPs, but still nice season, and they got a $5,000 marketing allowance. Last person had knocked the cover off the ball. 80 MA enrollments, 30 PDP enrollments, total of $126,000 in annualized premium. That's a $7,500 marketing allowance. That's not hard to do. You can really offset so many of your marketing expenses. And by the way, invest in your season so you have a great marketing season. That's what most agents tell me. Oh, why didn't you have as good a selling season? Well, I didn't have enough prospects, didn't have the funds to make sure my phone was ringing. Now you do. So, some frequently asked questions about the Medicare marketing allowance. First of all, who's eligible? All contracted and certified agents, brokers, and advisors. Everybody on this line is eligible. What's the time frame? The selling season of October the 1st through March 31st. Back in the old days, we used to save for January 1 effectives, but it just doesn't work like that anymore. So anyway, all Medicare Advantage and PDP sales, October 1st through March 31st. What products are included? All Medicare Advantage and Part D products are included. Get this, what carriers are included? All Medicare Advantage Part and Part D carriers. What can I use the marketing allowance for? Any marketing expense that helps your phone to ring, that helps you market your business and generate business. What can I not use it for? Well, we have a list of things that are not inbound, that are not eligible for the marketing allowance. Things like memberships, like a country club. I hear that from agents like, well, I get all my prospects by, hanging out at the country club. Well, I appreciate that, but that's not really what this is intended to do. Can't be used to pay your rent or your staff or your car payment or any of those kind of things. It has to be marketing. And there's a whole list of things that are inbounds and things that are not includable. So feel free to ask sales and they'll get to the details. What if you're in our NALP advisor system? Good news is NALP advisors are eligible for both their existing marketing allowance program as well as the Medicare marketing allowance program, whichever is greater. For those of you who are on this call who are in NALP advisors, I just sent you guys an announcement about an hour ago, so check out your email. What are the benefits of the Medicare marketing allowance? Well, you can use it for any marketing activities like direct mail, events, promotions, social media, sponsorships, retail. Do keep in mind that the more carriers that you work through NALP, the easier it is to qualify. So if you're thinking you're going to be selling more United and Humana this year, you may want to consider doing that through us to maximize your opportunity to max out the marketing allowance. And so often, this last bullet point I like to highlight, when I talk to agents about their game plan for the selling season, I a lot of times hear the same thing. I am hoping and praying that my FMO sends me some leads and that my carriers send me some leads. Man, that is not a game plan. That's just hoping and praying. You got to take control of your selling season. If you want to maximize your income, you want to take your sales to levels that you have never seen them before, you want to get your income to where you've never seen it before, this is the way to do it. You got to take control of your marketing. You just got to have the funds to pay for it. And that's what's the beauty of the Medicare marketing allowance. Now you have the funds. So now that you have the funds, what would you do if you maxed out that marketing allowance at $7,500? What would you do with it? Well, here's some examples. You could drop 15,000 pieces of mail, right? I'll tell you this. You can make a lot of sales if you can drop 15,000 pieces of mail. What about doing 10 sales and marketing events at $750 a piece? You might do 750 social media ads at 100 a piece. You could do 10 local TV commercial spots. You could do 15 weeks on average of local radio ads. You want to get your name out there? How about you run 20 radio ads a week for 15 straight weeks? Trust me, everybody in town is going to know who to talk to about their Medicare. Hope now your mind is starting to think about how you could use $7,500 in order to maximize your sales and your income. So excited about this. All right. What do you got to do next? And then I promise I'll answer any questions. So first thing you got to do is you got to have a bit of a game plan for the selling season. Decide what markets you're going to focus on, the product lines, the carriers, and you got to make sure that you've got a marketing plan on how you're going to generate prospects. If you're going to deploy this money in a way that provides you return, you got to have a game plan. You can't just spray and pray. Also, make sure you've got to complete any and all of your trainings, including certifications, early. And when I say early, I mean like yesterday. Then, once you've got your selling season game plan put together and your marketing plan put together, share it. Get some feedback from others. Share it with other agents. Share it with your sales manager. Share it with me. But share it with somebody else and try to get some feedback. You're going to want to get contracted and trained and certified. As I'd mentioned, I think a lot of these members, because of Scott and White and the changes vital or non-renewing vital traditions, a lot of them are going to be good prospects for United Healthcare and Humana. Don't make the mistake of running your United and Humana elsewhere. Run it through us, and then you can maximize your Medicare marketing allowance funds. Implement your plan and make a lot of money. Once again, if you're interested in working with us on United Healthcare, Humana, the new Cigna PPO product, which is going to be launched with a zero premium, the new Blue Cross product that's going to be launched with a zero premium. We're also launching a new AmeriGroup product. There's a whole bunch of really great Medicare Advantage carriers, not to mention Aetna, can't forget those guys. Long story short, send a note to sales@lifeplansllc.com, and they can get you started with whatever contracting that you want to do. You're going to want to have as many Medicare Advantage and Medicare Part D carriers with us as possible to maximize your opportunity to get that marketing allowance. All right, let's see what questions that we have. Seriously? All right. It's the first webinar I've done in ages. I guess, back in the old days, we used to have Scott and White meetings, and we would fill a room so much we'd have to have multiple rooms just to fit everybody in. But that was then, and this is now. And we have great opportunities for everybody. So if you don't have any other questions, I won't keep you. I wanted to thank you so much for participating in this afternoon's webinar. Please contact sales to get started with all your Medicare Advantage and Medicare Part D carrier contracts. That's the conclusion of this call. Thank you so much for joining. Appreciate you guys. Have a great rest of your day, and I'll talk to you soon. Bye-bye.